Wakefield would like to start the meeting at 7:06.
Maureen.
Melrose starts meeting at 7:06.
Okay. I believe we have public participation tonight. Dax Grantham is on the line. Dax, did you want to participate or are you just listening tonight?
We are listening, trying to find out what the status is for the personal services, and so we can get the spot up and running as soon as possible.
Okay.
If you go on to the state's website, let's see, Governor Order 35. On page 3, it says that Phase 2 personal services are in Phase 2, but your kind of services
Are going to not be the very first day, but I understand it's supposed to be. They haven't released a date of when it's going to be.
Well, they haven't released the date for the beginning of Phase 2, but there's like a Step 1 Phase 2 and a Step 2 Phase 2. And they haven't released those dates yet.
Right. What we were more concerned about was the order that the health department here in Wakefield had passed regarding the services. Are you going to follow the state's recommendations, or are you going, because I remember you had the emergency order in that.
They were repealed last week.
Yeah.
Okay. Yeah. I was looking for the what the ruling was on that, but we couldn't find it.
Okay.
That's why we're here. That's why we're here.
It's in our minutes tonight. Yeah. So we exactly did that. We did not want to be confused with, we didn't want to confuse things with the governor's order. So we are in sync with the governor's order. So whatever.
Perfect. That's why we're here.
Thank you.
Okay. And we
Thank
wish
you
you
very,
luck.
very much.
I'm going to need you really soon. Okay.
We all need him.
We're pre-selling.
Fabulous.
We're pre-selling discount appointments.
Oh, all right. Well, we'll take that offline, but good to know.
Thank you very much.
All right. Best of luck getting going again.
Thank you.
Okay. All right. So you have a pretty light agenda. So we should probably, I'm not pulling up the agenda again. If you want me to, I will, but I think we just have to review minutes. Has everybody been able to do that?
Yeah.
Okay. Any thoughts? Concerns?
I was okay with it.
Okay.
Oh, looks good.
Okay.
It's fine by me.
Okay. I noticed one misspelling of Lasitra.
Oh, you did?
Oh, wait, yeah.
How did I miss that?
And Cindy's already fixed it. So can we have a motion from Wakefield?
I'll make a motion to accept the minutes as amended by Cindy.
I'll second that motion to accept.
So that's Elaine to second. Candace made the motion, and all in favor. Gorville, yes. Elaine?
Silva, aye.
Aye. And Candace?
Candace, yes. Yes.
And does somebody want to make a motion for Melrose to accept the minutes?
Or I'll motion to accept the minutes as printed as.
Second the motion.
All in favor, Garapay, yes.
Chero, yes.
Lisitra, yes.
Okay. I'm not pulling up my share screen, but what's next, Ruth? Anything? Let's see.
Well, next on the agenda is Doug Lyons. But as I said in my health director's report, there, as always, things have changed on a daily basis. So the school committee was supposed to meet last night. They canceled their meeting. I guess there's a new chairman for the school committee in Wakefield. And,
Yeah, change their chairs.
and
Yeah.
so she decided not to have the meeting, and they are going with the plan that Doug explained, which is the small group, changing it to Landrigan Field, not Beasley Field, but Landrigan Field on June, excuse me, June 13th and 14th. So there wasn't anything for us to have to talk about because they've back to where they were.
And I'll just share that one of the committee members and myself, he was just really appreciating that the Board of Health was able to weigh in, and that's, you know, that really helps them as a committee, give some, I don't know, just some Board of Health backup for the decision. So, you know, it's kind of a nice example of how boards depend on each other, depending on, you know, kind of what basket we're talking about. So they were happy to get our ruling on that.
So, okay, so that's Doug.
Mhm.
Health Director's report, I sent it to you, but it was super late. So I don't expect all of you have had a chance to read it. So if you want me to go through it, I'm happy to. If you all read it, that's fine too. But I've just been on, I don't know, I've been on wall-to-wall Zoom and WebEx meetings, and
Oh,
it's just been a little nutty. So I keep trying to write it and I don't. So did you have time to see it? I don't think Frank did because he's still at work.
No, actually, I was just looking at it a little while ago.
Okay.
as usual, you're not getting anything done.
Right. So was there anything you wanted me to go over from that?
I'm surprised that the testing numbers were so low, given that, you know, people are still asking about it. And
Yeah, that's why we had to combine it. It was supposed to be Melrose last week and Wakefield today, but the numbers were so low, we put them together because they wanted 50, a minimum of 50, which I think we
No,
barely got.
quite got there. Yeah.
50 and a half, to be exact.
Barely, yeah.
And so
But,
there'll be another one on Friday, June 12th.
So, yes, we're going to release that information, I think, on Friday when we have press on, and I don't want to jump the gun.
Oh, I didn't say anything.
Good. Okay. Couple of Wakefield things that I put in there, just following up on stuff that we had talked about in the past. A couple of things that I didn't put on was the camp information was finally released this week. So we sent the guidance out to all of our usual camps and asked them to let us know if they're not going to be doing a camp. Melrose Volleyball did tell us they're not going to do a program this year, and Wakefield Boys and Girls Club is going to be doing their program this year. And we haven't heard from anybody else, but you know, that's okay. They need to comply this year with not only the camp regs, but also additional guidance that the state has put out. So, so they put out guidance, and then they've put out guidance on the guidance. So we're just waiting to hear. At the beginning, before we started, I did mention to Frank, because one of the questions came up, will the immunization requirements be waived? Because a lot of people haven't been going to the doctors the last several months, and it will not be waived. So they still need to be up to date with their immunizations. They haven't decided 100% on the physical requirement. So we're waiting to hear on that.
So is this on the DPH website, Ruth?
No, it'll be, the guidance will be on the mass.gov. And the part about the immunizations, I don't think will be any of those places. It was, as you know, we do these constant conference calls with the state. And it was just some clarification that was given to us because people are asking.
Mm.
So, I mean, the regulations stand the way they are. There's some new things that are required, like, normally they have to have one, is it not healthcare supervisor? Yeah, one healthcare supervisor on site, and now they need to have two. So in case one kid is sick, there's still another healthcare supervisor available. What else is different? The camps can have groups of 12, so that normally if the kids are over 6, it has to be a ratio of 10-1. For inclusion issues, they can have 12-1. This is so confusing. I'm sorry.
Yeah.
Like for all the youth programs that aren't licensed recreation camps, it's 10-1, including staff. But for rec camps, the kid ratio is 10-1, excluding their counselor, and they can have 2 counselors with them, so it's 12-1. So there's a few there's a few idiosyncrasies this year. So it's going to be a challenge. I mean, camps are always a challenge, and this will be even more of a challenge. Oh yeah, you know what? I got an email at the end of the day today from the sailing camp that they're going to be doing lessons, but not camp. I just got that one, so I forgot about that.
Quatapowit?
Yeah, the one at Quatapowit. They normally have a sailing camp all summer,
Right.
but they're going to do lessons instead. Any questions about camps? Because it's incredibly confusing.
No, I'm going to review the orders and not begrudge you. I'm just, we have no overnight camps in our jurisdiction, but I wasn't quite sure what the governor said on that, but I'm going to take a look.
Phase 3.
Okay. Which is the end of camp season. So,
Yeah, well,
God bless them
something
all.
I don't have to worry about.
Yep.
What about pools, Ruth? Have they talked about those yet?
Yes, they have actually. Well, the outdoor camps are supposed to, camps, the outdoor pools are supposed to be phase 2, but we haven't gotten the specific guidance. Indoor pool camp, phase 3, but then today they came out with some contradictory information. So we just sent emails in to the state saying, you just contradicted yourself. So stay tuned. What can I tell you? This is our days. So we're waiting for the clarification, but it sounds like outdoor camps will be phase 2, but we haven't any information on social distancing and that kind of stuff for the camp, for the pools yet. So technically they could be open on whenever phase 2 opens, but they can't practically because we don't have all the guidance. But they are, most of them are, we've talked to pretty much all of them. They're all working on opening. So that they, once they're allowed to open, they will be able to open. But that's kind of where we're at. They normally open on Memorial Day, except for Town Estates, which usually opens the middle of June. So that's kind of where they're at. And we're waiting to find out what did they really mean when they contradicted themselves. Outdoor dining is the other big issue right now. So again, there's guidance on the state website, but There's only a few places in each community that already has outdoor dining, like for Wakefield, it's Zuzu's and Sibo. And for Melrose, is there anybody besides Mexico Lindo?
Yeah, up on Franklin Street, the
La Cuchara.
Oh, La Cuchara.
La Cuchara.
Yeah, they have a couple of tables on the sidewalk.
Mm.
Those two. But really the issue for outdoor dining is trying to expand outdoor space so that they can have outdoor dining, logistically. Both communities are working on that because it will involve parking lots and sidewalks and parking spaces. So Wakefield, Steve is going to be presenting a plan to town council on Monday night.
All right. So we should-
And it will have some general guidance. And then what he's asking for, because technically speaking, with the zoning bylaw, the town council would have to approve every individual one, which is just not that practical. So the plan is that they give approval for guidance, and then he will look at each individual plan and do the approvals. And what he's presenting on Monday night has, certain streets being blocked off, certain groups of parking spaces in front of places blocked off, things like that. And then, of course, there's also the liquor license issues. So stay tuned Monday night for Wakefield, and I don't have anything specific for Melrose at this point. So even though technically they could do outdoor dining, the places that already have outdoor dining can start whenever phase 2 starts. The places that are going to add outdoor dining will have to wait to get permission from the city and the town.
So Ruth and Melrose, weren't they talking about doing kind of like when they do that summer stroll thing of just shutting down Main Street and making it pedestrian only?
I don't think they're going to shut down the entire street.
Or just a couple, a block or two?
You know what? I haven't seen it, so I can't comment.
Okay.
Um,
I think there was an article.
The existing ones, besides moving tables further apart, Mexico, they keep changing the definition of open space. We're on our 3rd definition. So the current definition for restaurants is that you can have a covering and 50% of the sides need to be open. And Mexico Lindo, 2 of the sides are the building.
Mm.
And then they have like plastic sheeting, to keep rain and stuff out. Those will have to come down. But at that point, once they get their tables 6 feet apart, then they'll be ready to roll. Frank, I just don't have the information for Melrose at this point, so I don't want to guess.
Okay.
Ruth, what about the Dunkin' Donuts on Main Street that has all the open windows?
I'm glad you asked that, Maureen,
Hmm.
because we're going to get the same question from Giacomo's, who has the open front.
They just have the open front.
That's indoor. They're both
Yeah.
indoor.
Okay, so Dunkin' Donut is indoor even though
Because
50% of it's open?
no, it's indoor because it's part of the building envelope.
Okay,
And that would be the same as public kitchen. And
Right. That's
Yeah.
the phrase the state used, because we asked that, was that this morning? What's today? Wednesday?
Mhm.
I don't know. We either asked it yesterday or today. And if it's in the building envelope, it's indoor.
Okay.
I knew we were going to get asked that question.
I'm just wondering how many calls the department is getting on clarification and if that's exhausting the system.
Well, it's exhausting Cindy.
Yeah.
Look at me.
I know. Well, just wondering if, it's time to have Jennifer to sort of help us with frequently asked questions, sort of just gathering and, the question of the week. I don't know.
Yeah, unfortunately, they're kind of all over the place.
Yep. Yep.
A lot of them are complaints like so-and-so's not wearing a mask, or people aren't wearing masks at the lake, or
Yeah.
that kind of thing. We've had, I would say, I don't know about you, Cindy, I would say dance studios are like a bunch of the dance studios, although it's very clear in the governor's order where they fall. But
So I guess you just have to have, like the blanket response is we are following state guidelines. You can find those guidelines at www. Blah, blah. And we already have the link.
you'd be
That's
surprised how
correct.
many of them aren't plugged into it. Like
Yeah.
hairdressers that have very, very clear guidance
Yeah.
on the state website. And, I said that Jen and Coral went around last week to all the barbershops and hair salons that were open.
Yeah.
And you'd be surprised how many of them we had to give them the guidance and the
Yeah.
posters that they were supposed to have up.
They
So-
weren't that, I have to say, I searched for it when it first came out. The website was not that nimble. So
State?
the state website.
Well, I would never say it's nimble.
Right. Well, so I can imagine that people gave up. So, whatever we can do, but just having that ready. And we started to do that. I think Cindy, you did that, saying, okay, this is it.
Well, maybe what we can do is have Jen put on the town website, like the specific things for hair salons, as they come out with specific guidance for particular things,
Mhm.
we can post those on there.
Yeah. I think that's
Because
good.
it is hard to find them on the state website. There's no-
It is. And so if we're just, if we can preempt that, and Jen's very good with that.
Yep.
That's
we
great.
can do that.
A lot of the questions are also that they want to know if we're doing anything different than what the state's doing. So they go to us to say,
Right.
I know we have this from the state, but are the local boards of health doing anything different? Like, is Wakefield doing anything different?
So maybe Jen could put a banner on the top
Yep. we
with the
could.
same.
I mean, we try to send out blast emails to groups of businesses that we can do that way. But as it turns out, the Division of Professional Licensure, you can't download a list of hairdressers.
Right.
You can download a list of licensed massage therapists. So it seems like depending on which license you have, sometimes we can download a list, sometimes we can't. We can send a blast email to all of our camps, all of our pools, because we have them. But, we got a call from a nail salon today, and she's like, well, how am I supposed to know? And I said, well, you're going to have to follow the website and the news, because I have no way of doing a blast email to every nail salon in Wakefield or Melrose,
Okay.
I don't know. Did I forget something, Cindy? I think
No.
that is mostly what we are doing. Oh, Melrose, our budget comes up next Thursday night at the city council meeting. It's remote. You don't have to be there. You're always welcome to be there. It's a new, it's a mostly new board, so they'll probably have more than the usual questions because they're new. And Wakefield, obviously, it's not till town meeting, which is now June 20, the 20th or the 27th? I can't remember.
It's not a
It's
Saturday.
the 20th.
20th?
Oh, it is a Saturday. That's
It's
right.
Saturday,
Yeah, it's Saturday.
9, in the field house. Um,
And Candace, when are our elections? The 23rd?
Yeah, the 23rd from 10 to 2 is voting.
But you can get an absentee ballot now. I know Betsy's been processing them.
Yeah, you can do them out down line.
Yeah, it's super easy to do. Also, she has a mailbox right outside the town hall, so.
Vote early, vote often.
Yep.
All right. Anybody else have anything of interest?
Ruth, I have one question on your drive-through testing that you did today.
Oh, that
It
wasn't.
wasn't drive-through. We did it inside town hall.
It was for COVID though, the nasal swab, right?
Yeah, it was.
Now,
I got tested.
I saw that. I know we're not supposed to say this, I guess, but if they plan any more of these,
We are
testing?
planning a public drive-through. Details to be announced.
Okay, do they need appointments or doctor's orders, or you can just,
No, well, yes and no. You do not need doctor's orders. You need to pre-register.
okay,
So there will be a portal, a link, and you fill out a registration form. And they will give you a time. And then you drive up at that time and get tested and keep on driving. And it is the nasal pharyngeal swab.
okay, but it's done from your car. You don't get out of your car.
You don't have to get out of your car, yeah.
And where would that link be if anybody wanted to know?
It won't be live until next Monday.
Okay,
So that's why we are in the initial stages.
okay,
But I was on a call with them at 4 o'clock this afternoon, and it'll go live Monday morning.
okay.
The information will go live.
I'm hoping to put information out starting on Friday, but I'm hoping to put information out Friday, but everything will go live Monday morning.
Okay.
Kind of maybe like a teaser Friday night,
Mhm.
because, the mayor does his nightly updated video things, and but the information will be all on our websites, and the portal will be live, and all that stuff will go live first thing Monday morning for everybody.
Okay. You don't know of any place that's doing antibody testings, do you?
Yeah.
Or you have to go through the doctor for that?
Nope. No, there are urgent care centers that are doing the antibodies, but I will caution you, the testing is not very accurate.
Mm.
Yeah, Melrose Wakefield is actually doing the test or offering it, but they're telling us to discourage our patients from getting it because it's very, very unreliable.
Exactly.
Oh, good. Okay.
It doesn't, the information.
Agreed. We've been
Yes.
doing the same with our patients in Boston.
Which is why we're not offering it, and it's why we didn't offer it to the employees. I
Okay.
told them that it's not reliable, and B, it doesn't tell you whether you're immune to whether you get it again.
Mm.
So it doesn't give you any information you can use.
Mm.
So we are definitely discouraging it. I mean, at some point, there'll be a good serology test
Mhm.
that will be fabulous to use, but it's not here now.
Not useful like that. Yeah.
Got it.
Anybody else? Any other concerns from Melrose or Wakefield boards? Or Wilfax? Or
Ruth, I wondered how the planning is for a town meeting in Wakefield.
I'm sorry, you kind of broke up. What about the town meeting?
I just wondered how the planning was going with you and the town and how everything was going, setting it up.
Oh, great. We did a walkthrough at 3:30, not to be confused with my 4 o'clock or my 2 o'clock Zoom calls. And everybody was there at the field house. We walked through how it's going to be set up and how everybody's socially distanced and how people who can't wear a mask will have their own area and bathrooms, and yeah, DPW was there and WCAT was there and Ann Santos and Bill and Steve and me. So it'll be fine. And the field house can really hold a lot of people, a lot. And there's also there are the stands that can come down that we could use. And there's the balcony that really, but I think the only thing that's really a big ticket item this year is the police station. And those kinds of items, the people who have strong feelings about that come, it's at the beginning of the warrant, they stay for that, and then they leave. And then there's the other people who come every town meeting and go through the whole town meeting. So, no, there's nothing, the budget that's particularly controversial or anything.
Okay.
But, it might be a little stuffy in there because we're not going to have fans going. We'll have the window, we'll have the doors open, and, people can get up and go outside if they need to take masks off or sit in their air-conditioned car for a few minutes. Do what we can do.
Okay, sounds good.
Yeah, it's good. The only non-COVID thing that I've been working on was the FDA grant that was submitted. We're supposed to hear sometime in June. I haven't heard anything yet. Melrose has the school nurse grant that obviously we couldn't spend it all on what we planned on spending it on. We got through some of the screening, but not all of the screening, and Gail was doing follow-ups to the screening. So we spent what we spent, and then we're spending the rest down on extra supplies, more masks, more thermometers, more stuff like that. So we will spend down the grant, just won't be on what we thought it would be.
Are there still folks using the hotel?
Let's see. I can't tell you as of today. In general, I will say yes. We have not had a lot of people who've needed it, but it's good that it's there for when we do have people. I mean, we have had Melrose, Wakefield, and Linfield people staying there at one point or another. And if my test comes back positive, I'll be moving in. But, it hasn't been, it's not like we've been using 13 rooms all the time, but it's been good that we've had it, and we'll continue to have it. I don't know. That's all I got.
Does anyone have anything else to say, or?
Those of you out in the field, Frank and Candace, are you seeing anything out in real life?
Well, we're seeing people come back. Surprisingly, a lot of them want to come back or even insist on coming back. And we have to remind them that, according to all the public health experts and Melrose Wakefield healthcare experts and guidelines, whatever that we're following, telehealth is still the way to go. And you see patients in person if you really can't handle something by telemedicine. So, and again, I think we'll get a big influx of kids coming in for vaccines, which have been put off, or people getting, their physicals this summer. We're going to be doing those by telehealth as well, and then coming in just for the shot. Yeah, I mean, that's pretty much it.
For us in East Boston, we've been having a bit of a challenge with employers of our patients requesting retesting, and we're seeing people positive on their nasal pharyngeal swab for sometimes even over 30 days. And it's sort of a hassle because, we probably shouldn't be retesting these people. They're well, and their employers are asking it of them. And so it's just keeping them away from work when these folks need to be working. So it's kind of frustrating. We've been writing a lot of letters, but a lot of the employers for the folks we look after don't seem to be kind of either comfortable following the CDC or DPH guidelines for 10 days since the last positive test and 3 days without symptoms.
Can I ask you one question, Candace?
Sure.
Because I've asked this question, but I didn't really know today. Is the health insurance covering retesting, or will they only cover it once?
My best guess is that all the testing should be covered.
Okay.
I'm not 100% positive on that, but I actually had a patient ask me that today. I believe if they get a test, it should be sort of covered for now, at least. I don't know, Frank, do you know anything else?
I haven't heard that question come up, but it is an interesting one because medically speaking, we're recommending one thing, and some employers, and I've seen this from the get-go, including hospitals in Boston and local fire departments, some employers are requiring the 2 negative test approach. So,
Yeah, but that's a different retest. You know what I mean? That's a retest for clearance.
yeah, the nasal pharyngeal swab, yeah.
Right, but what if,
Go
like,
back to work.
I got tested today and it was negative, and 2 weeks from now I decide I'd like to get checked again?
Oh, yeah, I mean, there's no medical reason to do it. So
I
if
did hear,
I was the one ordering that test, I'd have a hard time justifying it.
Well, if she was exposed, I
your
suppose.
insurance can give you a problem on the second time, because I was tested 2 weeks ago and was negative, and my husband will be going in for surgery, and I heard that I have to be retested again. But because it's for a reason, like if you're retesting because you thought you were re-exposed, or you were exposed, or you had a family member ill, that they'll pay for it, but you got to have a quote valid excuse the second time.
The answer I was given today is people should check with their own individual health insurance.
Yeah, most of them will pay anyways, I think. I don't know.
Oh boy. Laurel had to leave the meeting for a medical emergency in her family. Oh geez. Who's our vice? Elaine, are you vice?
It's Elaine.
Yeah.
All right, Elaine, you just took over the meeting.
Oh, thank you.
It's okay, we're almost done.
That's a good thing. She timed that right. I owe her.
No, you don't, believe me.
Is there anything else from Wakefield, Ruth, that you can think of? I can't.
I can't either.
I haven't heard anything really negative. I've seen a couple of people that own nail salons and hair salons here, and a couple of doctors, and down at the hospital. I've heard nothing bad about anything, really.
I've heard a little bit of concern about the town meeting. I read a little bit on social media, whether it's going to be inside, is that the right thing? Should it be outside? And then if we can have town meeting and graduation, the same stuff that you already went over, Ruth, and you already laid the reasons out, but I kind of heard people reiterating probably the same concerns that you heard initially.
Yeah, well, it's not like they're not reasonable questions. They're very reasonable questions, and the bottom line is you cannot make everybody happy.
Yeah, yep.
We're doing the best we can is all we can do.
How well attended are those town meetings typically?
They're usually 150, 200, roughly.
Okay.
It's an open town meeting, not a representative town meeting. So like Reading has representative town meeting and it's like 186 or 197 or I don't know, I can't remember anymore, but so it's always the same number of people plus whoever wants to sit and listen.
Join in, yeah.
But for Wakefield with an open town meeting, it's, you know, sometimes it's a bare minimum and other times if there's a hot topic, then like if there's a topic for the teachers, then you'll get a couple of hundred teachers will come to town meeting to vote on that issue. So you never know.
Yeah.
And I bet with everything going on, the attendance will be lower, just
I
with
think
people choosing to stay home.
And it's a Saturday, and if it's a nice day out, you know,
Mhm.
or people will be incredibly bored and will be looking for something to do.
Entertainment.
It can go anyway. It can go either way.
Ruth, you said that Wakefield Town Hall is opening, but Melrose is not.
Not yet.
So what is this big sign that says Melrose is open for business? I just kind of thought it meant City Hall was opening.
No, that's getting ready for presumably Monday or whenever phase 2 starts, when retail stores can be open and stuff like that,
Oh, okay.
but not City Hall yet.
Okay.
I will tell you when I know.
Got it. Is there anything else anyone has to say for Melrose?
Not I.
Nope, not I.
Anybody want to make a motion to close the meeting?
I'll make a motion for the meeting to be adjourned in Melrose.
Second.
So the Melrose meeting is adjourned at 7:47. All in favor, Garapay, yes.
Ventura.
Citrus, yes.
What about next week, guys? Did you want to continue on with, when is that, June 10th?
I may have a conflict next week, Wednesday at 7.
It's okay, Frank. We have 3 members now.
Oh, wow, excuse me.
You can have a conflict now. What is
Dependable now, huh?
what kind of phase 2 is opening next week, quote unquote? Is it restaurants or?
Well,
Yeah. Am I right?
if phase 2 starts on Monday,
Yeah.
then, hold on. Hold on. Oh no, that's the wrong thing. That's not the order. That's the guidance. Order. Retail stores, including stores and enclosed shopping malls, restaurants, blah, 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 hotels, motels, inns, and other short-term lodgings, no events, functions, or meetings, limited organized youth and adult amateur sports activities and programs, professional sports we don't care about, personal services, step 1 services involving no close personal contact like photography, window washing, individual tutoring, home cleaning, etc. Driving schools and flight schools, outdoor historical spaces, funeral homes, increased capacity to permit 40% occupancy for 1 service at a time, non-athletic instructional classes in arts, education, life skills for youth under 18 in groups of fewer than 10, warehouses and distribution centers, golf facilities, including outdoor driving ranges, other outdoor recreational facilities, including pools, playgrounds, and spray decks. Pools, we've gotten 2 different things. Day camps, including sports and arts camps, public libraries.
Do you think it's a good idea to maybe take a break next week where there's so many places and so many new things going to open up, and give ourselves a week to see if something presents that we have to talk? I don't know how anybody feels.
Elaine, I agree with you. And then the 17th is the third Wednesday anyway, which is Wakefield's typical night.
Oh, come on. You mean I'm not going to see you for a week?
Yeah.
I mean, if you want to come over and you could sit in my driveway and I'll sit in my driveway and
No, that's fine. I mean, if something urgent comes up, we can have a meeting, but otherwise,
Yeah.
just schedule it for June 17th.
Let's see what happens with all these things open up and see if there's some kind of problem that we're gonna run into, and then that way that might give us a week or so to kind of, I don't know what you would like, just like regroup, because I'm getting very confused as to who's supposed to be open to do it.
Yeah.
We're all,
And they
That's a
may
good
change-
point.
they may change everything again. You don't know. Tomorrow morning may be another call.
nope, not tomorrow morning, but Friday morning, yep, there will be another call.
It will be Friday. I got the thing for Friday, but maybe we'll change something again. They just did everything testing yesterday. They're gonna change it all again by Friday, so it doesn't matter.
The good news is that our numbers in Melrose Wakefield are very flat, which is great. Really good. So that's a good thing.
If you want to make a motion, Candace, to close the meeting at 7:52 for Wakefield.
I'd like to make a motion to close the meeting at 7:52 for Wakefield.
All right, I'll second that. All in favor? Silver, yes.
Linehan, yes.
All right, that's it. That's it. That's all you get.
Okay,
Okay,
thank you
so
very much, everybody.
we'll see you on the
Well.
17th.
Fun.
See you on the 17th. Stay safe.
Okay.
Okay.
Bye,
bye-bye.
guys.
Bye.
Weeks, wow.